excited for everyone to be here today. Excited to collab with one of my esteemed colleagues. As we're waiting for people to join, I see people are coming back. Thank you. Sorry about that, ladies. But why don't you take a minute and introduce yourself and let us know who you are and what you do?
Hello, everyone. My name is Mirala Cerneanu. I'm an OBGYN, conventional medicine trained. I turned functional medicine, integrative medicine, holistic, oriented, and focused in about 2011 when my father passed away, and I came in contact with a pretty unsatisfactory healthcare system. So I did it mainly as a hobby to protect my mom, but then it turned into an education, and then in turn turned into a, hey, this is the way I want to practice medicine. So I started my own practice in 2012. I actually started being more of a content writer, more interested in expanding, educating women outside of my own practice. In the past, I want to say about 3 years when I launched my podcast, the Hormone Optimizing Warrior MD. And now I have a private practice, which I continue practicing. And I'm also focusing on writing a book about hormones just to bring women's attention to this very important subject that has been literally ignored for the past 2 decades. So thank you for inviting me, and I'm excited about our conversation and sharing whatever knowledge we can to empower women to make better choices.
Yes, I love this. Thank you. We appreciate you for being here. And ladies, what we thought about when we started talking to each other was we hear this a lot. My friend does this for hormone therapy, or my sister's cousin does this. I saw this on TikTok. I heard this. All of these are really powerful things, but one of the things that we decided and became really united on was that we want to discuss and we want you to know the importance of precision guided medicine, personalized guided care, because there is no such thing as one size fits all from hormone therapy. And we know that this is a ebb and flow. And that's what we want to talk to you a little bit about today, about what it should look like to have hormone therapy, how you know you're with the right provider, right? And the importance of getting that precision guided care for you, because there's so many factors that go into this that are really about you, your body, how your brain is going to respond, how your estrogen receptors respond. And we thought that that's an important piece. So actually, I'm going to hand it off to you to tell us a little bit about when a patient comes in, what are some of the things that, we talked about this a little earlier before we went live. And so like, well, tell me what to do. What should I start first? So what do you say to that person?
So I think it's really important that during the first appointment, the woman comes in a little prepared. Because when they come in with zero knowledge, zero preparation, it takes a lot more time to explain all the possible options. Women still come expecting this paternalistic, what do you think we should do, doctor? What do you think is the best for me? It's impossible to know what's the best for you from the first visit, first appointment, even if I take an hour of my time to spend with a client, right? Do you agree? It takes a little bit longer to get to know someone than just a simple 1 hour. Even if they come prepared with a blood test, hormone levels, we look at everything. It's impossible to understand the impact all the environmental factors, the lifestyle factors have on what's going to happen in their body once we introduce hormones. And whether or not hormones are good for them, that's impossible sometimes to know until they actually try it. So I think it's important for women to understand the power of choice. And women hesitate. And I think that hesitation and this sitting on the sidelines, oh, I don't know, I'm going to keep thinking about it. I'm going to read some more about it. This is a little bit you don't have to dive into the pool, but you can put your toe into the water and you can figure out the temperature. So, and if you're like, okay, well, it's too cold for me, maybe I come back, or maybe I circle around, do a couple of laps around the pool, and then come back and dip my toe and see what happens. There's all kinds of things that can happen after the first visit. And sometimes women switch providers. They don't give the provider enough time to actually work with them. But most of the time, you have to choose your provider carefully from the beginning. You have to do some credentialing. You have to look at the work. You have to look at their experience. What do they specialize in? What's their training? I am extraordinarily surprised by people who come in and they've been treated by literally people with no, I want to say minimal credentialing and not a whole lot of experience. And they think because the hormones didn't work, it's the hormones are to blame. Sometimes it's not. It takes titration, it takes time, it takes experience. And one of the things that I am frustrated about is that the very minimal importance that is given to women who are just written a prescription, whether it's bioidentical company hormones or a patch, or they're getting a pellet insertion, it doesn't matter. It's like a simple prescription, right? And then, okay, well, come back next time, see how the hormones worked out. But there is no conversation about what are you eating? How much are you exercising? What stress level do you have? How happy are you? How much time do you spend, in meditation, gratitude, investing in your faith? I mean, there's so many things that we do not take into account that will impact the hormonal influence hormones will have on a woman's body. Because to be honest, we don't have a lot of time. Sometimes patients come in, they're like, okay, well, and then sometimes it's the other opposite. They come in, they get something, a pellet, a patch, and then they come back and they're like, well, my temperature's up. I have a fever. Is the hormones? I'm like, well, the hormones don't cause everything, and sometimes it's just a coincidence. But yeah, it's very difficult to decide what hormone to use on the first appointment sometimes. So a little preparation, especially if you go to a physician, looking at their website, their credentials, what do they know, but doing some education or research on their own, I think it's highly helpful. So they walk in with a little preparation, like, okay, so what's important to me is I want to choose based on financial reasons because this is how much it's going to cost. This is how much I can afford. I need convenience. I need it to be natural, not synthetic. I need it to be bioavailable and not go up and down. And I want to avoid hormone fluctuations. There's so many considerations that women don't really think about and they need some guidance sometimes. So that's why I think participating in circles like this, communities like this, where they get to talk to people that have experience and training and then can guide them a little bit so they can be more prepared for their first appointment or next
Yeah.
appointment, just third appointment.
Yeah. And I can't highlight enough that and I also want to say we know it's very difficult to find the right provider. So the network that I serve from the neurodivergent lens, a lot of these women have been to 4 or 5 different providers. And although they may get the hormone therapy, the hormone piece, right? Just like you said, writing that script, a lot of times the neurodivergence is missed, right? Or it's not addressed. And that can be a piece too. So from the neurodivergent perspective, making sure that the provider actually understands or has some sort of understanding. And we know this now, and we're not here to bash any providers or anything, but you can go get hormones. Literally, I say this on the street. Like that's how it is here, at least where we live in Sarasota. You could go to any med spa anywhere on the street and get hormones. Maybe those people have the education, maybe they don't. But that's where a lot of trouble can come. So yes, we got to take a little bit of time to make sure that the provider, has that. The other thing I would like to say is that, and I'm sure the same thing with you in your practice, we don't have infinite amount of time, but sometimes
Right.
we don't have to start hormone therapy on day one. Sometimes
Right.
that hour is going to be, hey, let's get to know you. What's going on in your life? What do you know about hormones? What don't you? But what's important from that relationship is that the patient has to understand. And what I think we want to know too is that healing isn't linear, right? And that this is relationship based. If we are going to get you to where you want to go and where we want you to go, it's not a straight path, right? And hormone therapy is certainly not a straight path. And what it does for one woman isn't what it's going to do for the other, right? And maybe we start someone on a patch and that doesn't work. But that is where that relationship with the physician comes into play, right? I get to know you, you get to know me, we trust, you come and sit in my chair and we talk about things, and maybe we don't start hormones on the first visit. Maybe you come back in the next one and we've given you some stuff to think about and you thing to do. Precision guided personalized care, right? We're practicing medicine not in a rush 7-minute visit, right? We want to give you the time. We want to help you explore these things because that's where healing comes from. And you also made a really good point. I think we've done a better job now. We're doing better at telling women the importance of hormones and how they work, and women, we should know about these, and debunking the things of the past, which is really good. But we've kind of also done a little bit of a disservice. I don't know if you agree with me, but we kind of made it like, oh, hormones are amazing in these things, and they are, but they're also precision guided molecules, right?
Right.
And you can't just like patch everybody up and shove them out the door and everything is right in the
Right.
world. And you brought up the point. That's not correcting for their sleep. That's not correcting for their stress. That's not correcting for the
Hmm.
sympathetic spiral that most of us live in nowadays, right? So, yes, hormones are very powerful and they can help, but you're not going to slap a patch on and or get pellets or whatever it is and like all is right in the world.
Right. So I want to interject on something you said. 2 points I want to make. Sometimes I use this analogy with my patients. When I see them, they're like a deer in the headlights. What should I choose? What do you think would work best for me? So I tell them point blank because I don't want to be the one making the choice for them, because choosing a hormone therapy involves responsibility, and a woman has to assume responsibility for her choices. However, what I like to say is, hey, hormone choice, it's a little bit your hormone journey, it's going to be a little bit like dating. So you might have to date a couple of options until you find your perfect one. There are women who start with the patch, they move on to the daily gel. Then right now, women on patches are moving around quite a bit because of the nationwide shortage. So you might move to the pellet, and then you love the pellet, but then the pellet is no longer affordable, or now you develop scar tissue. Pellet is no longer an option because of other problems, anatomical issues. So now you move on to something different. So this is what you do in life, right? You adapt, you overcome, and I'm just your dating expert. I'm here to tell you, hey, this guy, blonde hair, blue eyes, but his personality might not be a good match. It might look good on the outside, but it might not be good on the inside. So, and then, like you said before, and that clicks with a lot of patients. They actually feel a little bit more relaxed, like, okay, great. So we're going to start dating. So
Yep.
they understand it's not an all or none. It's not like, okay, patch or no patch. It's going to be a journey. And then, like you said earlier, 20 years, women were told hormones are horrible. And now suddenly, out of the blue, women think hormones are everything. And they might be everything for some women. They're not everything for all women. But you always have to pay attention, because the pendulum can swing one way, then come all the way to the other way, and then still. So until it kind of settles a little bit to where it's supposed to be in the middle, unless it's a forever pendulum, right? But this has been the history of hormone therapy, because back in the 60s all the way up to the 90s, hormones were the youth, the fountain of youth. And
Yeah.
Premarin, everybody was on Premarin. I don't know. I was around in the 90s. I was a resident, and the Wyeth Earth reps were selling Premarin and Primpro. They were coming in, they're giving us these pills like candy. We were prescribing them to absolutely everyone. Oh, you have heart problems. Let me give you some, Premarin. It's going to make it better. And that's where the study came from. They really wanted to see
Yeah.
if these hormones actually help heart health. We knew it was good for bone, it was good for hot flashes, insomnia due to hot flashes. It was used for, I mean, it was good for a lot of things. But they really wanted, it was run by the National Institute of Health, the Heart Institute. So it was really meant to see if it's going to improve cardiovascular benefits. And it didn't, because it's oral hormones, and oral hormones increase clotting and increase all these other things. So instead of saying all hormones are bad, we should have said, well, wait a minute, these hormones are not ideal. And they still do some good things, but they're not ideal. So instead of that, we just went with, okay, hormones are horrible. And a whole generation of women, unfortunately, got turned off from hormones.
Yeah, and then a whole generation of doctors didn't understand
Oh,
how to
yes.
prescribe hormones because we weren't taught it, because they were bad and it's something you don't do. And, and I wasn't around in the 90s from a doctor's perspective, but from what I've heard, the doctors giving women all these meds, and they're like, oh, when WHI came out, when it caused cancer, all this stuff. And they were like, where is all this cancer? Like, we've been treating these women for
I
20 years. Like, they're not
I
in
haven't
our
seen
clinic.
one. Yeah,
Yeah, they're
exactly.
not like, there's got to be some sort of disconnect. And yes, I think potentially, well, I think the pendulum has swung the other way only in the fact of that we're not telling, or doing a better job of telling women that that again, hormones have a significant impact, right? And they are needed. However, they're not, you can't hormone your way out of a very poor diet, sympathetic overdrive. And I bring
Totally.
sympathetic overdrive up because that is, especially from a neurodivergent perspective, that is what so much of us are dealing with every day, right? Our neurodivergent brains are like Ferraris and we're going and going and going and going. It's hard for us to get into parasympathetic. And so if we get on hormones, yeah, great. That helps this much. But if we don't do anything but just go on hormones, it's the same thing. If you go to the gym only once a week and you want to be muscular, that's not really achievable, right? We have to work on the other things, and address them. And that is, again, where that personalization kind of comes into play. Um, but along the way, that journey is a journey. I love that word you use. You use journey, and I actually love that. That's exactly what this is. And it is like dating. Sometimes it's speed dating, sometimes it's slow dating, right? Sometimes it's like, all right, let's get on the estrogen. And like for testosterone, for example, that's the long game, right? Because and by the way, I think all the hormones are she. That's just my personal opinion. I think estrogen is a she, testosterone and progesterone are all she's because, women rule the world. Um, but even like testosterone, for example, and I don't know, you probably have the same experience, but like a lot of times women need a longer, it takes 8 to 10 weeks sometimes to see effect, right? Where if you take estrogen, you kind of know in a couple of days if you're having effect or not. Or testosterone could be that longer game, you're waiting it out a couple months, seeing if that date's working out.
Yes.
Yeah.
That's mainly because testosterone impacts things that you can't see right away. The libido takes a while, just like any antidepressant would take a while to influence your neurotransmitter pathways and everything in your brain, your dopaminergic norepinephrine system, everything, serotonin. It takes time. So you need 4 to 8 weeks. So before you see mood improvement, before you see uptake in your energy, sometimes if of course, if the testosterone is high enough, you're going to feel like you can move mountains, right? Then you go to the gym and injure yourself, or drop a 15-pound weight on your toe and you fracture your toe, and that's the end of
Yeah.
your exercise. But I do think that when you start hormone therapy, talking about the parasympathetic and all the other things that you got to do, and you have to look at the big picture, not just, okay, I'm going to do hormones, it's going to fix my life. But sometimes hormones give you the right push in the right direction. So that's why I am very not encouraging and propose, like, empowering women to make a decision, because it's not going to be a wrong decision. Any decision you make about what you want to do with the hormones is going to give you data, it's going to give you information, it's going to tell you, okay, well, this didn't work for me, let's move on to the next one, until it actually you find your right niche, you find your right thing, your right hormone, your right provider, the right level, whatever it is that works for you. But start somewhere,
Yeah.
because not starting and not doing anything is really the worst possible option. Just living with whatever it is that a woman is living with, it's just not okay. Women live with a lot. And this is one of the things that I like to talk about. Women like to
Mhm.
put up with a lot before they actually ask for help, which is, we need to change that. Like, I have a very low threshold for tolerance. Like, if there's a problem, I don't feel good, I'm gonna get to the bottom of it. I'm gonna fix it immediately. But even myself, I didn't want the patch for obvious reasons, for adhesive issues and other things. I tried the creams for like a year and a half before I actually said, okay, I'm gonna do pellet therapy and let's see what happens. But meanwhile, I had been changing women's lives with pellet therapy for like 4 or 5 years, and I still hesitated. And I'm a doctor. I've been doing pellets. I knew everything about pellets. I understood, and I still hesitated. So I understand women who hesitate. But hesitating is one thing, and really not doing anything, or being on the verge of, well, I don't know, I'll think about it. I'll do something later. I think that's where women should probably be a little bit more proactive and make a decision, because that's tough. And especially when you talk about neurodivergent women, sometimes you have to weigh everything. And I don't know, do you feel like there's a tendency to procrastinate making a decision sometimes that could impact health and future and
Yeah.
relationships ultimately? Because hormones, impact your mood, impact your energy. And when you're tired and exhausted, you don't have time. And this is why most neurodivergent women actually get destabilized when they go through these perimenopausal midlife changes, because now you have to deal with fatigue and insomnia and hot flashes. So what you kept balanced and in control for a while, suddenly you can't do it anymore.
Yeah,
What
and
do you think?
we don't also realize a lot of times, so from the neurodivergent lens, we are talking right now perimenopause and menopause, but we've really been dealing with this since we started menstruating, right? So, 40% of the 8% of women that have PMDD are neurodivergent, right? There a significant portion that have postpartum depression are neurodivergent. So, we've been dealing with these and what I always like to say is like estrogen for us, whether we realize it or not, whether we put that name on it or not, it kind of was holding up. It was that weight bearing, load bearing wall on that all of the scaffolding and masking that we've built. So when we enter perimenopause and now that estrogen goes down and now we have even less dopamine to try to access, and also not just estrogen goes down, as you know, our progesterone and our testosterone have already been going down,
For a
right?
while.
Since our 30s. Yeah. So when that load bearing wall comes down, we can't function sometimes. We literally don't have the cellular capacity to do the things that we were doing, the masking, right? And all those things that we were doing to actually keep us functional and upright. So without, estrogen is a big powerful, all of the other hormones play a role, but like without that piece, um, our lives can like go to heck in a handbasket. And it happens for the neurotypical women as well, right? Like that's why
Yeah.
perimenopause becomes, this horrible time, or why women will actually think neurotypical women will think they have ADHD because they're starting to feel that, not as much
Hmm.
dopamine and not as much neurotransmitter perspective, but absolutely. And we add in the complexity of neurodivergence from the way of that a lot of the women have been to providers for years and years and years and been dismissed, right? So it is difficult sometimes for them to sit in a chair and say, "This is what I want," right? Or that can be, a lot of women, I'm sure, in your chair too, have cried, right? And there's like, "Wow, you have someone that actually like listens to me,
Listens.
isn't, yeah,
Yes.
isn't
Yep.
judging me," and that is the piece where I think is most powerful. You and I can do the most we can, see as many women as we can in our practice. We can educate residents, we can try to change the medical system, but why what we're doing right now is more important than all of that we do in our clinic is because the more women that we can educate and the more women that get up and say, you know what, I'm not going to stand for this anymore. They're right. I need personalized guided care. I'm going to ask for what I want, and they arm themselves. That's how we're going to change the system, the broken system.
I agree. And I think women need to face their challenges and not bury them deep. And I'm going to give you an example. Many times when I ask women, so do you have fatigue? I get a very interesting answer. They look at me like, I'm not sure I understand your question. And they start telling me, well, I do all the things I want to do. And I said, but how do you feel? Well, I feel good. I still finish everything I want to do. And I'm like, okay, do you have the same energy you had 10 years ago? And here it comes. It's like, oh no. And I struggle and I have to push through. So I'm not asking what you do, I'm asking how you feel. So a lot of women, I think all women, their mothers, their wives, their daughters to someone. They hold the household together. They are professionals. They have careers. They might be the sole provider for their family. There's so many things that women carry that they just push it all down. When it comes to, okay, so I can't sleep. I'm not feeling good. I'm gaining weight. My appetite is changing. I got cravings. They take a long time to actually come to terms with the fact that something's changing. They need to take action and work on it faster before it really becomes a problem. Now you have, 10 years of weight gain. Now you have 10 years of mood changes. So I think honestly that the sooner women act on it when they realize I got a problem. I never had PMS, but now I have PMS. Well, I had PMS, now I have PMDD. Things are getting worse. Um, I had a little bit of postpartum depression with the first baby. Now it's a lot worse with the second baby. Things are changing. Your hormone environment is evolving. And I think now that hopefully more and more women are aware of the value of their hormones, this is one of the key pieces that I think we need to educate women on because I don't think they know. Like, hormones do pretty much a lot and everything. They're not everything for everyone, but they're there, and they're one of the central pieces of the scaffolding that you mentioned before, that kind of hold the inner workings of a woman's body together. So when these hormones are out of whack with each other, or they're completely deficient, there will be some major changes. Hormonal, I mean, brain changes, mental changes, emotional changes, and then physical changes. And it's regardless which one drives the other one, they're really interconnected, and one cannot really function without the other.
Yeah, and you bring up a really good point, which is that I think we've been conditioned as women to take on more and more and more, right? We've been conditioned as women to just carry the family, do what you're supposed to do, be quiet, do this, please other people. And that becomes exhausting, but it also becomes a second nature in a way. Like, I think I feel a lot of women that I see in my practice, they don't even really know they're doing that, right? Like, just as you
Right.
kind of mentioned, you have to pull it out of them. You have to,
Right.
like, are you fatigued? Like, we have this badge of honor about, like, oh, I can do everything. I can still do everything. Well, what does that mean? Like, how are you getting there, right? Do you have to take a nap at 3 p.m. because you can't possibly, like, go on any longer?
Yes.
And they're looking also to us, right? I would scream this also to all of the providers out there and all of the physicians, like, hear this, right? See this, what we're talking about. You have to ask. We have to ask, and we have to empower women to ask and bring it to them. But we also have to empower ourselves and providers and other physicians to say, look, you got to look past the, like, oh, what are you here for? Oh, you want estrogen? Like, we got to start having these personalized relationships back again. I like to think of it like I wasn't there back in the day, but this is just what my thought is, like those old country doctors, where they knew your horse and your cow's names and your kids, and, like, they're generational doctors, right? Like, we don't live in that world anymore. I understand that, but that's the relationship base that has to be with a doctor, or your provider, is to really understand that, because we have to get to the bottom of it. And as women, we have to empower each other. That's a piece. We want to create generational change, right? Like, I want to impact women that we see in our office today, but I want to do something bigger than that. I want to teach them that what happened to us isn't okay, and that we should be talking about this, and we have the right to, and we should be demanding personalized care. So guess what? We teach that to our daughters and our nieces and all the girls that we care about in our life, and we create a situation that isn't like the one that we have, where we are looking at, oh, you know what? It's probably not good if you are can't function a week before your period, right? Like, before perimenopause, right? If you are, like, want to kill yourself, or ruin the whole thing and blow up your marriage, you're a girl who
Mhm.
can't go to school, that's probably not something that's good. Guess what, folks? That's hormone related, right? So
Right.
now we add in perimenopause when things are really going crazy, or menopause, maybe it's surgical menopause, whatever it is. And now things are really out of whack. And we should have been educating women, or we as women, we should be getting the knowledge of, like, this was going on since I was 15 and started menstruating. Right. And starting to develop that piece. And I think it starts with what we're talking about today, though, is how to change the world. Right. I wish we could just bippity boppity boo and change the world. But it starts with conversations like this in communities, where
Right.
then you go to your friend at dinner and say, hey, I started on hormone therapy. Maybe not necessarily, this is what I do, you should do the same thing, but, like, this is what it's done for me. Or your friend is suffering, you're like, hey, have you ever thought about estrogen? Or, wow, and as we educate more and more women, those conversations happen. We're pretty powerful as women, right? We get together and we have these great communities. And you brought community up before. You said, what are you doing for joy? Right?
Mhm.
Loneliness is equivocal in the longevity world to smoking 15 cigarettes a day,
Yes, it's
right?
terrible.
Yeah. So this is why we have to have community and we have to be talking to each other and, and saying these things across the table. And, I'll give you another one we haven't talked about today, but like vaginal dryness, right? Like no woman in the world should have vaginal dryness. Like,
Right.
right? Like this is such an easy thing for us to treat. Yet so many women
I
go around.
I wrote a piece about painful sex, and women deal with painful sex for years before they go to the doctor, which is mind-boggling to me. And I said we should treat painful sex like a heart attack. It's a 911.
Yes.
First painful sex, you go to the doctor the next day. Hey, doc,
Yeah.
check me out. Is there a problem down there? Oh, yeah, you have a little infection. Let's treat it. It's over. You're done. Oh, you know what? Yes, things are dry. Your skin is changing. You have lichen sclerosis. Let's check your hormones. Now you start the conversation. Now you know you're on the right path to not have that happen again. I mean, I don't understand women that like get to the point where they haven't had sex in 2 years because it's been so painful, and they're like, "I feel so bad for my husband. I love my husband." But so anyway, painful
And I
sex,
actually tell them, I
911.
say, I feel bad for them. I mean, probably, they can feel bad for their husband. I don't, but I feel bad for them because imagine this is the piece, right? This is part of the education piece. Like, this is what I think women should be talking about at dinner parties.
That's
I
what I
love,
think women need to do. They do not prioritize themselves.
right. We don't.
And they come from this role. I got a career. I got to do my job. I got to take care of my kids. I got to take care of my family. I got to provide. I got to clean house. I got to cook. I got to do all these things. I am last. Well, if you're last, you're not gonna do all these things, or you're gonna drag through them, or you're gonna do them in a manner that's probably gonna impact your relationship with your children, impact your relationship with your husband, affect your career, because you're not gonna do them from a place of love and abundance and feeling great. You're gonna do them from a place of deficiency.
Yeah.
Hence, you need to do something about it. So I think women need to treat their hormonal imbalances, deficiencies, anything weird that's related to hormones pretty promptly, because the earlier we act on things, I love this 1 ounce of prevention is worth a pound of cure. It's so much easier than trying to reverse something that's metabolically ingrained and physically impacted you for like a decade.
Yeah.
Um, and do you want to talk a little bit about the personalization of therapy and why that's important, how women are so different,
Yeah.
and why that matters?
Yeah. Absolutely. So I'll start and then you can go if that's okay.
Okay, sounds good. Yes.
Um, Yes. So even just talk, and I'll talk through the neurodivergent lens because that's obviously my niche. But I always say this to every woman: one neurodivergent woman is not the same as the other. What works for my neurodivergent brain is not going to work for yours, and that's where personalization really comes in. And taking into account all of the things that we've already said, right? Someone's stress load. What do they do for work? What does their activity look like? Because this, you and I, we can make an amazing 40-page guide, right? Okay, do this hormone, take this supplement, do that. But if it doesn't fit into your lifestyle, you're not going to do it. You're going to throw it in the garbage and it's null and void. So part of the process that's why I don't like the getting, your hormones off the street. That's a little, crazy, but you know what I mean. Um, I don't love that because you're going to stop, or the second that you have maybe a complication or a setback, or one form doesn't work for you, but another could. If you don't have that relationship, that personalization, you're going to say, oh my gosh, estrogen doesn't work for me. I tried it. I got breast tenderness. It doesn't work for me. No, that's not it, right? It's the form that didn't work for you. Or maybe we should have put you on some progesterone first and then started the estrogen or whatever. So this personalization and really understanding, again, you've hit a lot of really good points, which is that we're socialized to put ourselves last. I don't think that women choose to do that. I think we lived in a society where what's been expected of us to do. And it's time to stop that. And I completely agree, right? All of us need to rise up and we need to put ourselves first. Um, But then that's where that precision piece comes in, right? So maybe it is, some vaginal estrogen and treating, the vaginal dryness piece first. And maybe for me, it's estrogen. Maybe for someone else, it's progesterone. Maybe it's testosterone, right? And as you've already mentioned earlier on, it takes time for us to develop that and to know that, right? We know what estrogen does. We know how to prescribe it. We know what progesterone does. We know how to prescribe it. We know what testosterone does. We know how to prescribe it. But how to give you what you need, I say that people understand the word biohacking now in this
Right.
world, right? And I think just like your speed dating, I think that hormone therapy is a little bit like biohacking because it's kind of like, okay, well, we got to see what works for you. What are the majority of your symptoms, right? I hear that as I'm sure you do, right? And there's estrogeny symptoms, there's progesterone symptoms. We can kind of make, and what I say is I don't like to choose for anyone either. I say, hey, you're really struggling with this anxiety, you're ruminating, you're not sleeping, right? Like we would benefit from a little bit of GABA first, right? Or you have high, night sweats, hot flashes, every joint in your body is aching. You have, plantar fasciitis and frozen shoulder and, all these things. Maybe we should start with a little bit of estrogen. So we can guide it a little bit, right? From that perspective. But that's why personalization matters because
Right.
what one woman feels on 50 with an estradiol level of 50 may be great to someone and it may be terrible to another woman.
Right. So I want to point out the fact that our inner workings of the human body, the female human body, are as unique as our fingerprints or our retinal scan. So, and the way each brain works, it's also as unique as our fingerprints, our retinal scan. So, faces don't look the same. We all have our each individual characteristic. So I have a problem with the way we approach hormones for women in general. Like, here comes the patch, there's 5 doses, and this is going to apply to everybody. That's
Right.
impossible.
Yeah.
Mass produced synthetic products are great, maybe for 50% of the women. They're probably not going to be great for a huge amount of women who are not going to either want the patch or feel good on the patch or have problems with the patch. So I think people need to understand, and this is one piece of the puzzle. The other piece is, okay, so you put hormones in your body, but are your metabolic pathways friendly to the hormone that you put in your body, the amount of hormone, the type of hormone? Because our metabolic pathways are really what is generating the influence that the hormones is ultimately going to have, and it's going to determine the safety of that hormone and the lack of or the presence of side effects. So, when everything is introduced in the body, it has to be detoxified. So, our liver is really impacted by how much alcohol we drink. So, if your liver can't handle between alcohol and hormones, it's always going to choose alcohol. And I tell that to my patients all the time. Why? It's probably a survival inner guided process because alcohol impairs you. So if you go to work the next day, you probably can lose your job or, the tiger's going to eat you. It doesn't matter what century we live in,
Yeah.
right? But whereas if you just do hormones and they might give you cancer, oh, they're going to push that in the background. So it's very important for people to understand that the way you eat, the way you sleep, the way you drink, the way you exercise, the way you sweat, the way you talk to other people, the relationship in your life, this is your environmental impact that's going to impact your metabolism. And that's going to impact how the hormones work in your body. So each woman has a unique metabolism, a unique environment. So coming in and saying, well, my friend really likes the patch. Can I try the patch? Sure, you can try the patch. Just be open minded that you're not going to have the same consequences your friend had. So, this is what I think the missing piece that many women need to understand. That's why I think, I personally think, because I'm a certified menopause society practitioner, I think all doctors who see women for whatever reason, whether it's a orthopedic doctor, a urologist, a nephrologist, if they treat women after the age of 50, they should all be mandated by the state, by the state of California, whatever state they practice in. You need a curriculum on menopause.
Yeah.
Go read everything you need to know about hormones. And I'm sure that the Menopause Society has a like 200-page manual. It's actually individualized for different chapters in a woman's life, for cardiovascular, for
Yeah.
go read that chapter, you
Yeah.
know, take a little test. And then you'll know. So when one comes to you says, you know what? I'm 52 and I started having stiffness and now I'm having all these problems with my joints, instead of being like, well, you have arthritis and here's a ibuprofen, be like, well, maybe this is what's happening with your periods. Well, yeah, I stopped having periods 6 months ago. I have hot flashes, can't sleep. Maybe you should see a hormone expert. You don't have to, not everybody has to prescribe hormones, but understanding that there is an opportunity for you to guide a woman to hormone therapy, I think that's a missed opportunity for so many physicians, including cardiologists and nephrologists and neurologists and internal medicine doctors and so on and so forth.
Yeah, and don't forget neurologists because so many women are going for their getting checked up for dementia and palpitations, right? And especially ortho, right? Plantar fasciitis, frozen shoulder, right? A lot of that stuff. Again, I agree with you. I'm not saying that the orthopedists have to prescribe hormones, but if you're treating women of this age, you should know what's happening to them. And just as you would, if it's something out of your expertise, you would say, if they went to the orthopedic and say, I have GI bleeding, they would say, go to the GI doctor.
Right.
You still recognize that GI bleeding is a problem, right? So we should still be, as physicians, recognizing, ooh, this could be hormone related. You should probably see someone, like you said, you should probably see a hormone expert.
That's that generation of doctors that got completely uneducated, untrained, not told anything about hormones, and they don't know anything.
Yeah.
I have women coming in and saying, yeah, the doctor told me it's going to give me cancer.
Yeah.
What kind of cancer? Oh, breast cancer.
Yeah.
No, that's as far from
Yeah.
the truth as it could be. So then women immediately get the deer in the headlights. Well, who should I believe? This
Right.
doctor has been treating me for 10 years, or you, who I kind of read about, or my friend recommended, were saying hormones are great. So that's why it's a wall that is built, and some women have trouble coming out and build destroying that wall of fear around, okay, are hormones going to damage me? Hormones are not going to damage you because you already had hormones. From the age of 12 till the age of 52, for 4 decades, our body was flooded with these hormones. When these hormones go up and down, we don't feel good. And when these hormones start declining and go away, then we don't feel good at all. Start to, have a lot of problems. So women have suffered in silence. And I think it's time to move that silence and make it more verbal. And I really think it's a good idea to continue being part of a community like yours, like mine, where people find out the right information, can ask the right questions. And I do think that one of our main let's say, challenges right now in the healthcare system is not having enough doctors that are educated and hormone friendly that can actually do the personalization of medicine that
Yeah.
women need around hormone therapy. So some women might need to resort to online physicians who live in other states because that would be the physician that would serve them the best. But even those, there's like huge organizations like MIDI, right? And they actually are a little bit more like drive-through medicine, from what I found out from patients who are coming to me. They do patches and some testosterone cream.
Right.
They're very limited in what
Yeah.
they do. So I think women need to have the option to be offered every single option. Like, okay, I do patches, I do gels, I do creams, I do vaginal ring for estrogen. I do everything. And I make it my business to know all the available options for estrogen.
Yeah.
I want to treat women with all possible options because you can't have a one size fits all. That's not going to work. And that is one of the challenges with mass produced synthetic hormones. They are meant to be a one size fits as many as possible.
Most. Yeah, one size fits most. And also taking in, this happens to neurotypical women too, but neurodivergent women, a lot of us have sensitivities to stuff. So like if you told me that I'm wearing a patch, I'm not doing that. Right. And also some things we don't even further than that, some things that are in the adhesive. So sometimes corn, right? Corn is used in alcohol based things and we have corn sensitivities. We may not even know that, but you put that on your body and then it's inflamed. And this is where compounding comes in. And with the right pharmacy, obviously regulated, right? But I mean, guys, compounding pharmacies have been around. Like that was back in the day what you did. You went to your doctor, you went down the road to the pharmacist. it was mostly guys then. He crunched up your meds, made them for you, and voila, you were out you were out the door. Yeah, and I want to be cognizant of all of our time, and I want to hit something home that I think we've been trying to say all day today, and hopefully that you've gotten and you feel, because I feel your passion and your drive for everyone, but it's that we have to stop accepting mediocrity, right? Done is the time, and it is part of, as women, it is part of our responsibility. But we have to do that with backing of community, getting the right resources, which is why we've built these communities, to talk about those things, to talk about what you deserve and what you should be asking for. And it stinks that the system is the way that it is, right? And we will over time make progress, but I hear a lot of women say, like, well, what's the point of going and asking for it when they're going to dismiss me? Right. And it happens in my own community. The things that I hear still today in 2026 that women are being told by OBs or PCPs in my community right here is still mind blowing to me. And so you and I can't change that for them. Hopefully, we can be big enough and loud enough that our physician colleagues are going to take the things into consideration. They're going to go get educated. But we need you women, right? We want to focus, at least I know, and I'm sure you do. I want to focus on the masses. I want to focus on the education piece and empowering women to start asking and demanding what we deserve and what we've deserved all along. And realizing that you deserve personalized guided medicine, understanding that this is a process and it takes time. And I do have to find the right provider. And if the one that you're with isn't working for you, leave, right? Like we also feel obligated, I think, sometimes, like, oh, well, that's been my doctor for 10 years. Okay, well, seasons change, folks. And like maybe they were great for 10 years, but now they're not the one, right? And it's okay to understand that you need something different and to go out and to find that different because it does exist. We are out here, and we're growing more and more, right? Like A4M, all of our societies, longevity docs, longevity medicine, like we are here, right? We aren't the masses in that world, but we are here and we're coming. And with your help and understanding what you deserve and what you should have and the nuances of that. You don't have to know everything, right? I don't expect you to know all the things you should be on, right? But I do want you to know that this is what it should look like. And it is going to be an ebb and flow and it is going to be relationship based. And it shouldn't be like, okay, here's your patch, move on. See you in 3 months or 6 months or whatever they do. And that really, yeah. And there really should be more nuance than that. And then you can look for those people because they exist.
Yeah, and sometimes the journey with of 1,000 steps or 1,000 miles starts with your first step. Sometimes, even if you respect your physician and you feel for them, sometimes it's just such with something as simple as, "Hey, I learned. I'm kind of trying to decide if the patch might be right for me. Do you mind if I try it? Do you mind if you prescribe it for me?" I mean, it can start with a simple conversation, and you'd be surprised because people who don't know anything about anything, sometimes you know they are willing to actually help you if you have a relationship with them. So approaching your physician a certain way might actually yield unexpected results. So if women respect their physicians, they've been with them for a long time, encourage your physician to keep an open mind, and then maybe
Yeah.
even say, hey, if you don't do this, do you mind if you refer me to someone? Do you know of someone? This is your community, this is your OBGYN.
Yeah.
Do
Who would
you
you send
know
me to?
that I can go to that could help me with the hormone piece if you don't do it? And then that way that OBGYN is on board. So then if you go to a hormone person who's not an OBGYN, you will need management. You will need ultrasounds, you'll need pap smears, breast exam. You'll need to look at, how do the hormones impact your reproductive tract? Do you have abnormal bleeding? Now you need to go see the OBGYN again. It's good to have a relationship, not have this adversarial, okay, so my OBGYN says I should get off the hormones because they're causing bleeding and my lining is thick. Well, yeah, you're taking estrogen, your lining is going to be thick. The
Yeah.
thick the lining, it's a moot point when you actually take estrogen. So we need to change the standard of care and the way we look at things because the lining is only meant to look at if you're not on hormones.
Right.
So considering a thick lining, if you're on hormones, is the same as looking at a young woman that has hormones and, oh, let's measure your lining. Your lining is 5 millimeters versus 25 millimeters. What does that mean? Well, it means it's in a different cycle phase. That's
Yeah.
what.
Right.
So, going to people who can put it all together and look at the big picture, and like you said, personalizing care and taking the everything into consideration, not just giving you a prescription, but asking you, what do you eat, how much alcohol do you drink, do you exercise, all of these things. This is a key piece, and empowering our patients to take and the women who are in our communities to take action. I think this is what, if there was one message I could send out, is get off the sidelines and make a decision. I think it's really important. And if you've made the decision that's not right for you, change. There
Yeah.
are a million other options that you can do, between all the options for estrogen, all the options for testosterone, and all the options for progesterone. There's a multitude of combinations that you just haven't found the right one.
Yeah, and that's excellent point. And in to close it out, that's the thing. If you've tried something, one thing, maybe even two things, and it hasn't been right for you, that doesn't mean hormones aren't right for you. That just means you haven't found that right combination, right? The right dosing, the right combination. So looking for those providers and physicians that understand. I really think that perimenopausal care and menopausal care, women's care in general, besides pregnancy piece, is whole body care. We already kind of hit that home. It's metabolic. It's not just about an organ, right? It's actually about your entire system and really is whole body care. So today, ladies, I want you to go out and I want you to talk to your friends. If you learn something, if it's something sparked with you, share what you've experienced, because that is how we create change. That is how we create generational change. We deserve this. This is what we need in our world, but we have to, in order to do this, we have to band together, right? We have to be in these communities. We have to share that with our friends. We have to normalize talking about this at dinner. And I always make the joke about talking about your vaginal dryness at dinner, but that's what we should be talking about, right? Like, do you have vaginal dryness? Oh no, I'm on vaginal estrogen, or those types of things. We have to make these conversations part of what we do, and starting to walk back, right? Walk back all the things that we've been taught about how we need to stay quiet and stay in the corner and suffer, right, in silence, because we don't need to suffer in silence. And these options are out there for us. So I thank you. And go ahead.
Say one last thing before we
Yep,
end.
of course.
Of having the conversations at dinner, even if your husband is there and your husband's friend, your friend's husband is there, because they want to know too. They want
Yeah.
happy women. They want women who they can satisfy, they can be intimate with and enjoy the relationship. So they're not going to run out. Some men are running out, and that's fine. That just leaves you to have more of a honest and open conversation. But men might be like, the ears are up, like, oh, okay, oh, why don't you do that?
Yeah.
Can can I come with you to the appointment? And I've had couples who actually show up to the appointment. So involve your partner. If you have challenges and the relationship is rocky, that being open with your partner and expressing that and involving him in your decisions might actually save the marriage, save the relationship, gain you some points, and get another friendly shoulder to lean on.
Yeah, and also I see a lot of partners from men and women perspective, so, husbands or wives. Sometimes they don't know. It's a lot with the men, but women, if your partner is not of the same age as you, they might not really know what you're going through. And so a lot of times I've had my couples in here and they're like, "Oh my gosh, that's really happening to you?" Like, because sometimes when we're like, "Oh, vaginal pain," or whatever, we don't even say that, right? We just avoid sex. Right? Because the brain shuts it down, right? Again, remember, libido is a mood, ladies. So if you are having painful sex, if your hormones are all over the place, if you have inflammation, your brain is never going to tell you spontaneously to have sex. It's not going to do that. It's not
No,
built to. So sometimes just the understanding of that verbalization, like, wow, like you're really doing that. I can't imagine, and there's probably, there's bad partners out there, but I can't imagine anybody's partner like wants them to have pain. And so sometimes having that vulnerability, but the biggest piece of that is normalizing this, right? Again, that generational change, normalizing this for our daughters and our granddaughters and our sons, right? Normalize talking about this kind of stuff. So they talk to their wives or, their daughters about it, and having it be a dinner piece, or it doesn't have to be. But, I think the point of it is that we should be screaming this from the rooftops. We should be talking about all the things that impact us. Um, and not sitting in silence anymore. So go talk about it, be about it. I know we both are going to go because we have more patients to talk to and do things, but I thank you so much for taking your time with us today. I really appreciate it. To the ladies, thank you for being here. Please share with your friends. You're all awesome.
Thank you. It was a pleasure.
All right. Have a wonderful day.
Thank you. You too.
Bye.